Hi, I am Dr. Honda. I give lectures to students who are taking USMLE, and I make slides. So I decided to put that on YouTube too. Okay, today we're going to talk about teratogens. Okay, teratogens are chemicals that are not safe for women who are pregnant or planning to become pregnant. They may cause birth defects, pregnancy loss, prematurity, infant death, or developmental disabilities. Okay. Disclaimer: this video is only for educational purposes for students who are taking USMLE exam. Okay, this is not for anything else. And first, we're going to talk about pregnancy categories. Okay, these are simplified so that you guys can remember easily. Okay, you see this? We talk about evidence of risks. There is not evidence of risks, or there is evidence of risks in a human fetus or animal fetus. Okay, so pregnancy category A, no evidence of risks in a human fetus. Okay, and category B, no evidence of risks in an animal fetus, but they don't know about human fetus. Okay, and category C, there's evidence of uh, risks in an animal fetus. Okay, and category D, evidence of risks in human fetus. You see this: no evidence, no evidence, 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 and you get human fetus, animal fetus, animal fetus, human fetus. It's easy to remember this way. Okay, and pregnancy category X is teratogenic, contraindicated, always risks are higher than benefits. Okay, so painkillers and analgesics. Okay, when your patient has pain, okay, when your patient is pregnant and has pain, okay, and you don't want to use NSAIDs or aspirin or opioids. Okay, we're gonna talk about that. Okay, NSAIDs is okay, non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen, okay, some others. You want to avoid them in late pregnancy because they may cause premature closure of the ductus arteriosus. Okay, ductus arteriosus. You want to review the circulation of the fetus. Okay, and you want to avoid aspirin in a late pregnancy because it may cause bleeding to the mother. Okay, and opioids for prolonged use, you don't want to use them too because it causes dependency in the mother and in the fetus, and also it might cause smaller volume of the brain in the fetus. Okay, painkillers. Okay, acetaminophen is considered safe if there are no contraindications. You know that acetaminophen, if you use um, more than the usual dose, it causes liver problem, right? So you have to be careful with acetaminophen when your patient has a liver problem. Okay, and when your patient has headache, migraine, okay, again, this is a pain, so you don't want to you got to be careful with the NSAIDs and aspirin and opioids, obviously, and you don't want to use ergotamine because it may be abortifacient. Abortifacient significa, sorry, abortifacient means uh, basically abortion. Okay, and okay, I use sometimes Spanish because I speak Spanish sometimes. Okay, in my work. So pregnancy is it is pregnancy category X. Okay, so it's contraindicated, teratogenic. Okay, and what's safe? Considered safe. Okay, and headache. So has acetaminophen and caffeine. Okay, and acne, when your patient has acne, you don't want to use vitamin A and its derivatives, isotretinoin, etretinate. Okay, you don't want to use them. What's considered safe is benzoyl peroxide. Okay, and when your patient has nausea and vomiting, okay, Um, Basically, well, nothing is considered not safe here. But these are the first drugs that you want to use: vitamin B6, okay, and doxylamine. This is antihistamine. There's some other antiemetics, okay, that you can use in a pregnancy, but these two are the first drugs that you want to use, okay. GERD, okay. When your patient has acid, okay, in too much acid, right, basically uh, in the stomach, you can use antacids. Calcium carbonate is the drug of choice, and also you can use histamine H2 antagonist. Okay, it's an antihistamine. Okay, famotidine, ranitidine, cimetidine. You can use that, and also you can use proton pump. Okay, inhibitor. This is not H. This is I. Proton pump inhibitor. Okay, omeprazole Prilosec is considered safe. Okay, and when your patient has upper respiratory tract infection, again, you don't want to use NSAIDs and aspirin, all that. Okay, what's considered safe? Acetaminophen, you can use them, and also you can use diphenhydramine. Okay, this is also antiemetic. Okay, this is all first generation antihistamines. Okay, chlorpheniramine or diphenhydramine. Okay, you see this ramine at the end. Okay, first generation antihistamine, so safe. Okay, considered safe. Okay, and also you can use second generation antihistamines. Okay, cetirizine, Zyrtec, or loratadine, claritine. Okay, and antibiotics. Okay, when your patient has some kind of infection, bacterial infection, you don't want to use tetracycline or quinolones or sulfonamides such as sulfamethoxazole. Okay, streptomycin also you don't want to use. Okay, what's are considered safe? Penicillins, cephalosporins. If your patient is not allergic to penicillins, okay, you can use this. Macrolides, you can use them too. Okay, antihypertensives. When your patient has hypertension, okay, you see this ACE inhibitors or okay angiotensin receptor blockers. Okay, you don't want to use them. These medications are very common, so you gotta check what your patients are taking. Okay, and a reserpine also is not good in a pregnancy. Okay, what's considered safe? Labetalol, hydralazine, nifedipine, methyl dopa, clonidine. These are considered safe. Okay, and when your patient has epilepsy, okay, seizure disorders, okay, anti-epileptics, anticonvulsants, okay, almost all the anti-epileptics, okay, these are contraindicated. Okay, these are contraindicated, and also we're going to talk about psychiatric agents. These are also most of them. Okay, almost all of them are not good. Okay, so you have to review what your patient is taking. Okay, if they have seizure disorder or any psychiatric disease, and it is all about benefits and risks. Okay, for example, if your patient is seizure disorder, which is not a control, and you have to control it, okay, in order to save the life of the mother. Okay, if you don't save the life of the mother, and you can't save the life of the fetus. So in that case, the benefits is benefits are higher than the risks, right? But you want to always you know uh, consult new neurologist, okay, and which medications are good and not good. You want to and also you want to consult OBGYN a doctor, okay. And if your patient has psychiatric problem, anxiety disorder, benzo, well, basically for anxiety disorder, SSRIs are the first line, right? But you can use benzo too, and but you don't want to use them, okay. When your patient has depression, uh, you can use TCAs, okay. Bipolar disorder, lithium, okay. You can use lithium for these drugs, but when your patients are pregnant, you want to avoid these basically. But again, it is all about benefits and risks, okay. When your patient have some psychosis, which is not controlled, and there's a risk of homicide or suicide, and basically you want to use some of these drugs, okay. So you want to consult basically OBGYN doctor and also psychiatrist, right? Okay. And thromboembolic disease, okay. If your patient has thromboembolic disease, a tendency to have coagulants, okay. And if coumadin is not good, okay, warfarin or coumarin anticoagulants, okay, these medications are not good for the fetus. And what's considered safe? Heparin or low molecular weight heparin, okay. And other medications, this is the list of other medications, okay. You don't want to use androgens, estrogens, or synthetic estrogen, okay. DES, diethyl stilbestrol, okay. Also basically alcohol and tobacco smoking, that's just their habit, your patient's habit, they have to stop it, okay. And also you don't want to use disulfiram for alcoholism, because this causes problem in the fetus. If your patient has some kind of cancer, and well, you have to basically consult oncologist and OB/GYN doctor basically. But you just have to know that you know the agents for chemotherapy, you don't want to use them. For example, cyclophosphamide, thalidomide, you don't want to use them, okay. If your patient has fungal infection, gluticel is not good for the fetus, okay. And if your patient has psoriasis or rheumatoid arthritis, you don't want to use methotrexate. And also you don't want to use misoprostol, which is a synthetic prostaglandin E1 analog. Also, your patient has hepatitis C, you don't want to use ribavirin too. Okay, that's it. These are the references that I use, okay. And thank you for watching. Please subscribe. I'm gonna put more videos since I make slides for USMLE students. And okay, so thank you for watching. Bye.